Hi, I'm Dr. Kath Cosgrave, and this is a brief presentation on what is Attract, Connect, Stay. Just a little bit of background about me and how Attract, Connect, Stay came about. For about 20 years I worked in community development, and I was really interested in addressing service inequities in rural Australia through creating evidence-informed solutions and programs. I'm a social scientist, so I've always been interested in understanding human experience and why people do what they do. I'm a qualitative researcher, and I use grounded theory methodology to explore people's lived experience, and I draw on that data to create theory. Brene Brown is perhaps the best known grounded theorist, and is famous for her work on vulnerability, courage and shame. Grounded theory is all about resonance and fit. So people like yourselves should see themselves in the theory that has been created. Attract, Connect, Stay is a framework that was developed from my PhD, which I started in 2012 and was awarded in 2016. It was a grounded theory study that looked at the factors influencing rural health professionals' stay or leave decisions. And since then, I've tested the resonance and fit of that theory in public health services as a researcher, and more recently in the last 5 years as a consultant working with rural health services, as well as rural leaders to implement the Attract, Connect, Stay solution in their organisations and in their community. My PhD study, I was in search of a good news story. I was fairly naive at the time, so I was doing a study on rural mental health workforce, and I wanted to know why people living in rural and remote areas of Western New South Wales stayed in those public health positions. And that was mostly a nursing and allied health workforce. So I explored why people chose to stay, but actually it was more a study about why people chose to leave. So some of the key findings were all professions undergo an initial job adjustment period. And this is a really vulnerable period when the seeds of turnover intention are easily laid. Newcomer staff commonly describe feeling alienated. They discuss rural communities as being welcoming, but not always inclusive. But the good news is that sense of belonging can increase over time. So the longer people stay, the more sense of social connection and experience of belonging emerges. So this adjustment process that I spoke about has this early adjusting phase is in the first 3 months. And one participant described it as a rabbit in the headlights kind of experience in the workplace. And if they're newcomers, this is the phase where they're addressing most intensely their new settlement needs: housing, partner employment, schooling, childcare, and connecting into the community in terms of personal interests and socially. For the remaining 12 months, it's a continuing process of learning the role and settling in, and for newcomers to settle into the community as well. And after 12 months, there's the process of weighing up whether they're going to stay or leave usually begins. And the study also found that in the first 12 months, there was, as you'd expect, as most participants were particularly focused and concerned with the job, and spoke about professional satisfaction. And newcomers were willing to tolerate some degree of a lack of personal satisfaction in this adjustment phase. But after 12 months, everyone's focus became much more, in terms of their decision to stay or leave, around determining that they were more interested in their personal satisfaction rather than professional factors. The job by then was good enough. This was a study that only interviewed people who had been working 12 months or more. So it did not capture what for people who left earlier than that, and what might have been the reasons behind that. I theorise that mostly that would have been organisational and workplace concerns, and possibly cultural issues and relationship issues. Some other key findings from the study was the theory is that was developed was a rural-based professionals' stay or leave decisions to hinge on the gap between their life expectations and the realities of the job and rural living experience. Factors affecting these decisions can be generally grouped into job or personal satisfaction elements. And job and personal satisfaction are key factors in the decision to take a job, leave a job, or stay in a job. And so this is a diagrammatic of the theory that I just mentioned. The factors affecting professional were scope of role, workplace relationships, access to continuing professional development, and opportunities for career advancement within the local, either within the organisation or locally. And the extent to which this was experienced and which the order in which these were important was influenced by career stage and time in the job. All of those related to professional satisfaction. This was well identified in the literature before my study, and my study confirmed that these were key factors. A major contribution of my PhD study was really identifying this part, the personal factors, and theorising what was actually going on here. Prior to my study, this had been a bit of a mixed bag. We knew that there were definitely personal factors were a key determinant of retention, but we didn't quite know how it worked. So I identified that social connection and the ability or the assessment of a town and a community to meet future life aspirations of the new worker and any family members were key in this being satisfied here. This was influenced by time living in the town and life stage, and I'll talk more about those factors in the next few slides. So basically we get professional and personal satisfaction, and it's a weighing up process over time. So some other key findings were that the three factors identified as most significantly influencing job and personal satisfaction are life stage, career stage, and degree of familiarity with place and rural living. And these are really key to get your head around because they affect recruitment and retention, and we must be thinking about the individual's life stage, career stage, and their degree of familiarity with place and rural living to improve attraction and retention. So I'm going to dive in deep here. Why life stage is important is people's professional and personal interests tend to differ depending on which life stage they're in. So I have three life stages that I speak about: early adulthood, middle adulthood, and senior adulthood. Roughly, although age is not always the determinant, we can say those in early adulthood are in the early to mid-20s, middle adulthood, mid to late 20s, all the way to mid-50s, and senior adulthood, mid to late 50s. In the early adulthood category, they are highly mobile, experience-seeking, and experimental, and they're really interested in skills development and support. So career advancement is a key interest, and this is often why early careerers who are in early adulthood will go rural. Personally, they're interested in finding a partner, and so if they don't assess that this rural community that they're living in and working in is a place where they could find a partner, this would almost certainly push them out. In terms of middle adulthood, this is a more settled down and stable phase of life. It often involves family formation, but not always. It's just a more settled phase, and it could involve purchasing of land or animals or all the things, but just less experience seeking. An interesting finding here is from the literature is that place attachment strengthens as people enter this life stage. And that means where they're currently working will be a place that they will consider as a possible place that they may stay. and want to raise a family. Or it's also the point when people from a rural background may consider going home to their rural town and to their family connections. So there's a real opportunity it's important to know what point people are and really be looking at people in their late 20s as this decision-making process begins. They're really interested, of course, in flexible work arrangements. And they continue to be really interested in career opportunities, but these need to be definitely in place. So what can be offered in the local region as a collaborative of organisations or within an organisation. As I said, their concern is about work-life balance. The senior adult group are in their mid to late 50s. This group has reducing family commitments, and again it begins to start to look like this early adulthood group. They're more mobile, they can be experience-seeking and experimental. There are lots of people sitting in urban areas who would love an opportunity to live and work rurally, at least for a period of time. They're particularly interested in leaving a legacy and career consolidation at this point in time. Not a group that can be really important, particularly if you've got a team with a lot of early career and early adulthood staff in it. Just quickly on career stage and why this is important, because the less experienced, the longer the adjustment in the workplace will be and the more support that's needed. So I define early career into two: beginners and intermediate. First 3 years, they're really still beginners, but and then enter into an intermediate phase for 3 to 5 years. Experienced as between 5 and 10, and highly experienced as 10 years plus. This would not necessarily look like this if it was we were doing an urban assessment. This is because people gain experience very rapidly. That baptism by fire is often being described as, but they get clinically quite competent fairly quickly because of the depth and breadth of their scope of practice in rural. So, and in terms of familiarity with place and rural living, why this is important is that workers recruited from elsewhere need support to settle and connect. And this is really, of course, a sliding scale. At the far end, we have overseas newcomers who have little experience of rural Australia and maybe not of any, so a lot of cultural challenges there and a lot of things that they need support with, licenses, bank accounts, all the things. But a key group that often gets missed is these returning new locals who are really a type of newcomer and do need a level of social support, as they've often not lived in their rural community for between 5 and 10 years and sometimes more, and so their social connections have withered a little, and those that have stayed in the town have often gone on and had children while these people have been at university, so they often need a top up with social connection, not always with the settlement supports that people who don't have existing connections in the town. Other rural newcomers from rural and regional towns are probably the easiest to relocate and will have the least adjustment. So these two groups are really great to recruit from. But city newcomers, there are plenty of people living in cities who meet the sort of temperament or have the temperament that would do well in rural, and so they're not to be forgotten and could be a real area to target your job ads, depending on certain factors. So the final findings were, not surprisingly, it's relatively easy to attract early career professionals in early adulthood, but it's difficult to attract experienced professionals in middle adulthood. In terms of retention, it's difficult to retain early career professionals in early adulthood beyond 2 years, and that's very common for people rural healthcare employers to tell me that 2 years is about the maximum they get out of their early careers. But you're very likely to retain experienced professionals in middle adulthood beyond those 2 years, and more likely around the 5 to 10 year mark. So hard to attract, easy to retain, or hard to attract but easy to retain, or vice versa. So well worth keeping that in mind too. After I finished my PhD study, I felt I really wanted these findings to be put in practice and to be useful for rural communities to be able to, and health services to attract and retain health professionals. So I felt that based on the findings, that the framework needed to be person-centered, place-based, and encourage a holistic approach. So based on my PhD research, as well as other empirical research in the last 10 years, investigating effective rural health workforce strengthening strategies, as well as research that I've been doing in the last 10 years involving interviewing key rural health stakeholders and businesses, I developed the whole of person retention improvement framework that has out in the world. It's called the Attract, Connect, Stay framework. So this is the Attract, Connect, Stay framework. It has 3 domains: workplace and organisational, community and place, and role and career. And it's individual. This is what needs to happen to attract and retain staff. So workplaces need to be friendly, supportive and inclusive. So we need a good person-centred, good culture, good systems, all the things that we know that are important for job satisfaction. In terms of the community in place, newcomers, this particularly relates to newcomers, need to feel settled in and be supported to become socially connected and develop a sense of belonging. And in terms of role and career, there needs to be opportunities in place to build skills and access career pathways. So, as I said, this framework has been peer reviewed and published as the PhD study. Nearly all my papers are open access, so you can just Google them or Google my name, and you should get to those papers quite easily. So just so you know that it's not just me saying these things, in 2021 the World Health Organization reissued its guidelines on rural health workforce, and it said all interventions should be interconnected, bundled and tailored to the local context. And in terms of appropriate strategies in the part that I work in, attract, retain and recruit, or attract, recruit and retain, they said these things. There needs to be a whole of community approach, and this needs to involve community and health stakeholders. So, really my framework and the World Health Organization's guidelines are very in alignment. So after completing my PhD, since 2016, as I said, I've been working with rural health services, both public and private, to implement the Attract, Connect, Stay framework. And through that work, I've developed 5 implementation pillars for successfully implementing this framework and getting the greatest impact from it. So 3 of those factors sit in the workplace and organisational domain: attract, recruit, settle and connect in the organisation. And then settle and connect in the community is the community and place domain, and enrol and career is the stay domain. And here are what we're trying to achieve under each of these. Attract is about attracting a strong pool of ideal candidates. Then recruit is about recruiting the best fit candidate. Settling and connecting in the organisation is about settling staff effectively and quickly into the organisation. And settling and connecting newcomers successfully and locally into the community is this part. And the stay part of the retention part is supporting staff in person-centred ways to foster their professional and personal development. so they choose to and want to stay. In conclusion, there are two important things to remember: the importance of life stage, career stage, and familiarity with place and rural living on workers' job and personal satisfaction needs to be considered both for attraction campaigns and retention strategies. And the importance of taking a person-centered approach to recruitment and retention. Job, career, and personal factors all matter in deciding to take a job and then whether to stay or leave in that job. And if you want to learn more, you can visit the Attract Connect Stay website. Here's the QR code here. There's lots of resources on that and training opportunities and all the things there. As well as I'm pretty active on LinkedIn and YouTube, and if you want to follow me, please do there. And I'm a little bit on Facebook and Instagram. Thank you very much for your time.